You've been doing this incredibly in-depth modeling of the spread, and now you and your Instagram co-founder, Mike Krieger, are unveiling a new website that will show the daily US infection rate and update live. What do you want people to look at this and take away from it?
Well, the whole idea here is that there's this number called the effective reproduction rate. And it basically means how many people get infected per person who is currently infected. If that number is less than one, then the infection's under control. If it's over one, it means that it's growing out of control. So we're trying to take what is a complex topic and boil it down to a simple number that anyone can view from their home just by visiting RT.live. And that's our hope, is to make it simple for everyone.
Instagram's growth was the epitome of viral in the online sense. What are you applying here that you learned from Instagram? Obviously, you have some unique insights into how we all socialize, and how does that apply to the model that we're seeing?
Well, I think there are two parts here. First, I want to say this website is simply the productionization, if I could call it that, of a notebook that I published and a model that I published. The idea was just that you could access it without having to press refresh, every day on the model. Separately, the viral growth that I saw at Instagram, I think, compares to the science of viral growth in general. Now, there are vast differences between an actual virus and the growth of a company, but they use similar math. And by using that similar math on this actual virus, you can actually come to some really interesting conclusions, including estimating this number R that we're talking about that explains how fast the virus is growing.
So explain to us Luddites then, how much worse is this going to get? And how much worse will it get before it gets better?
Now, here's the really interesting part about that question, is that you can't answer that question in general. Often you'll try to find people give a very broad summary at the highest level across either the world, across a region or a country, but it turns out that this virus is very local, that Louisiana may be doing far better than Massachusetts, might be doing far better than, I don't know, Maine. You have to ask what's happening locally, and here at this website, RT.live, we're basically breaking that down on a state level so that you can see what's happening around you. So I can't answer specifically when this gets better, but what I can do is give you effectively radar into seeing how it's going currently where you live.
Well, you do get really granular state by state. So let's take New York, for example, and maybe California, because we're both here. And I want to know, if you look at those two states, which have had vastly different kinds of outbreaks and different responses, what do you see?
Well, what's super interesting about those two states are that, number one, they've gone through a transformation and a lockdown. So you can actually see R used to be something like 2 or 3, meaning for every person that got sick, they would make 2 or 3 other people sick. And that's the reason why a lockdown is so important. And after the lockdown, you see the effective R number come down. And it comes down as we all begin to social distance, as we stop going to school, as we stop going to the workplace, as we stop shaking hands, as we start wearing masks. That the R number comes down. But what's super interesting is as we begin to become a little bit more lax, as we begin to open certain sectors of the economy back up, the question is going to be, what happens to that number? Does it go back above 1? And I think that's why this dashboard is so important, because it gives you a live insight into the effects of the choices we all make. And I don't know exactly what's going to happen, but I'll be watching the dashboard just as closely as you will.
Now, you correctly predicted that the US would have 10,000 cases by March 19th. Meantime, you also point out you're not an epidemiologist. You have said you're showing this to policymakers. Who have you showed this to? How have they responded? Has anyone from the White House reached out?
Well, I have sent it out broadly, mostly because I hope that people take the concepts largely into the work they're doing, not necessarily the conclusions that I'm making. Because I'm one person, and the math that I run is specific on the data that I'm using, and there are a bunch of different sources. But the idea that we can manage our country or a state on this idea of an effective reproduction number, basically, that's the thing that I want people to understand. And if you watched Governor Cuomo's address yesterday, he got deep into the idea of this effective R number and the idea that we can watch R as we start to make changes and as New York starts to open up again. And it can be that gauge that allows us to decide what to do. I don't think anyone sent my blog post or my model to Angela Merkel or her team, but she spent all of yesterday talking about the effective reproduction number as well. My whole goal is to build a vernacular around this concept of R, and to have us realize that I believe, and I truly believe this, that it's the most effective way to manage coming out of this lockdown and manage the virus going forward.
Now, as you say, we're trying to balance economic prosperity with public safety. And you have President Trump outlining his plans to reopen the economy. You have some governors pushing back, saying it's too soon, and others who say we need this now because the economic impact has been so dire. If you could say one thing to President Trump about how to manage this reopening, what would that be?
Well, I think that it's customized, that you have to look locally and you have to give power to local government because the local government understands their current situation. And if you look what he and his team have done, they've basically done that. They've said, we realize that this infection and that this virus is a local epidemic as much as it is a global pandemic. And all of us have varying needs and all of us have varying levels of infection. So to give one medicine to every patient doesn't make sense. Instead, what we need to do is give customized guidelines and a framework to each local government and allow them to follow the best practices. And I think that's what they've done. And I think that's correct.
Is there something that scares you most about this in terms of people feeling or not being concerned enough or not being careful enough?
At the beginning, at the beginning, I felt strongly that people weren't concerned enough. And very quickly after California shut down, all the other states started following suit. And then I had a sigh of relief because I knew people were taking it seriously. That doesn't mean we're out of the woods. And the concern that I have now is that people think we're past, quote unquote, the peak. And all the models that you read are just as complicated, if not more complicated than mine, and rely on a bunch of assumptions. And no one really understands where we are. So instead of trying to predict the future, what we're trying to do at RT.live is understand where we currently are. Because the second we start opening up, it might go well, but it might not. And depending on where you live and the type of industry you're in, it could go a bunch of different directions. So the most important thing we can do is effectively have this radar, right? To know where we're headed and what's in front of us. And that's what we're trying to do at RT.live.